Hi, welcome to the Healing Medicine Show as part of the Healing Medicine LinkedIn Live newsletter. This is a show that provides a platform for health and healing professionals to grow in their understanding and practice of what it means to be a healer. We aim to provide healthcare professionals with resources and inspiration for both personal and professional development practices, especially those that are rooted in holistic health. We believe that change in healthcare starts by focusing on the health and healing of the healthcare providers. If you have a colleague who would enjoy this show, please send them the link to subscribe to this newsletter. Also, special thanks to one of our listeners, Chrissy, who encouraged us to put up the replays so that if you can't attend live, you can enjoy the replays at a later date. So today I have a special guest, Bruce Berger. He's the creator of the Commit Motivational Interviewing Program, who has been trained in health psychology and health communication for over 35 years. Bruce, you have single-handedly been responsible for introducing the motivational interviewing ideology into pharmacy and also into other healthcare professions. So I want to start off this interview by asking you, what does healing mean to you?
First of all, I wanted to say thanks for having me. I'm excited to be here. And I think healing for me is a process. It's successive steps of, if I'm talking about, healing myself, it's first, recognition that there is a problem, a wound, whatever you want to call it, so that I'm aware of it and I then take steps to do something about it. When I first started teaching motivational interviewing, to answer your question even further, I really didn't know what I know now. I knew the skills. I knew, quote, the spirit of MI as taught by Miller, but I didn't know me as well as I know me now. In psychology, there is clinical psychologists go through something called introspective practice. And what that's about is if they're learning, in the process of learning to be clinical psychologists, as part of their PhD training often, their sessions with a patient will be recorded, and a mentor will listen to those sessions and will ask oftentimes after they listen. So I noticed when the patient said this, you said that, what was going on with you, when you said that? In other words, what kind of triggered you to feel like you needed to, in that moment, save the patient? And so we don't do this in healthcare. And I was fortunate enough to have a good friend who's a clinical psychologist who did this with me, because I wanted to learn more about, what my triggers or wounds were, because motivational interviewing is patient-centered. And you can't be patient-centered if a patient says or does something that triggers you, and all of a sudden your stuff is now in the middle of the conversation. And so, again, healing to me is a process of becoming increasingly aware of how your own woundedness, your own triggers can get in the way, and then doing something about it so that increasingly they don't get in the way of having a good conversation with a patient.
So really what I hear you saying is that knowing yourself made you better able to serve patients at this level because you weren't bringing in your own preconceived notions. You weren't bringing in your own projections and your own wounds and putting that on them. So I can really see how, especially when you're dealing with a high stress environment like healthcare, and you're all over the place. You've got metrics to meet. You've got 1,000 scripts to fill, and you simply don't have time to speak to the patients, or if patients are getting upset with you, how that can kind of trigger some underlying wounds, perfectionism, some of those things. So I want to ask you, what kind of healing do you see that really needs to take place in healthcare and in pharmacy in general?
Wow. Well, from a big picture perspective, I think fee for service creates all sorts of problems for healthcare professionals in the sense of it puts them in a very time limited environment. I've thought about a lot of pharmacists who are working in environments today that are very stressful, where they don't have enough help. These pharmacists took an oath to put patients first, and in these environments, that's just not possible. Otherwise, they may risk their own job. Yet in those environments, they often don't even have time to check their own work. And if you talk to a lot of these pharmacists, they exist in some level of horror of, did I just do something that might have harmed a patient? I can't imagine how stressful that would be, especially if you were perfectionistic at all. The other thing that's operating there that I don't even think we talk about is the concept of shame and responsibility, operating a couple of different ways. I think we really have an expectation that our employer is going to support and protect us. We don't expect employers to interfere with practice standards. And yet that's what we're seeing. And we can talk about all the reasons that they may have to do that in today's fee-for-service environment. But the reality is that we're putting people in environments where they expect employers to protect them, when in reality, employers are saying, keep up or you're gone.
And this is causing a lot of basically trauma. Like we kind of talked about PTSD, and
Yep.
that's why I wanted to have you on the show today, because you and I have these discussions all the time, really talking about what pharmacists are facing and how we can help the profession advance and evolve, and really having an understanding of how to fix our own issues, and fixing not just what's going on, but being able to make the space and make the time to really listen to what's going on, and have true patient-centered care. It's difficult to be in that situation where there's all these expectations that are on you, and pharmacists, healthcare professionals in general, are dealing with some major stress, major burnout, and even some PTSD. So what in your experience what are these people dealing with? Like, what is the first steps to becoming aware if you're struggling?
Well, I think, I listened, I was reading on LinkedIn the other day, somebody did a poll and asked pharmacists, whoever responded, if you had to do it again, would you become a pharmacist? And about 80% said no. Now, granted, it's a biased sample, it's people who respond, but the fact that so many people responded no, and what you hear people saying is, my job is joyless. I go home at the end of the day and I feel depressed. Those are signals, strong signals to me. If you're looking at yourself, that one of two things needs to happen. I either need to get out of this environment, as soon as I can, when I can, economically, et cetera, or I need to find out how much is the environment and how much is me. and do that and start thinking about doing some of that work, because it would be awful to wake up every morning and think about going into something that's joyless. Now, having said that, I also work with pharmacists that are actually working with supportive environments. They're stressed out for other reasons. they're stressed out because either they have not had the appropriate training to really deal with patients, or even if they've had the appropriate training, they may not have done their own internal work so that they're not triggered by patients, even though they're in a good environment. So that I work with a lot of MTM pharmacists. And a lot of times they want to know, how do you deal with difficult patients? What do you do when the patient gets on the phone and the first thing they say is, hey, I don't need to talk to you. I talked to my doctor about my medicine. And the pharmacists get upset. And I ask them, why are they upset? And they say, the patient's being mean. And I say, okay, so what? And I'm not doing that glibly. I'm saying, help me with that. And I want them to understand that what is it about them that's causing them to take this personally? Are they able to even hear that many patients are saying, look, I don't know you. I've been scammed before. I don't want to give my information out to somebody who might take advantage of it, or me. And if, on the other hand, if you're feeling attacked, the ability to even say to that patient, your information is private and important to you, and you don't want to be talking to somebody who you can't trust. Would it help if you could ask me a few questions about your medicine so you can trust I really am a pharmacist that's working with your health plan? That kind of response is not even available if you feel attacked.
Mm-hmm.
Does that make sense?
So I think, what we're talking about, because I think some of these words, triggers, wounds, trauma, they're immediately, you're thinking, okay, this isn't me. I've never had big T trauma, but there's more subtle nuances. Like when we're dealing with a difficult patient and maybe we're taking on too much responsibility and trying to fix someone, and they disapprove of what we're doing, then we respond defensively, and it just kind of perpetuates that cycle. Is that what you're talking about?
Yeah, or we can, well, let me put it this way. We know from studies now, and there's actually been some MRI studies that have shown that motivational interviewing, actually takes place in the prefrontal cortex. The complex thinking area of the brain, the complex area of the brain that is able to navigate emotions and facts and nuances, okay? And to be patient-centered, you have to be in that part of your brain, all right? When we are triggered in any way, let me give you a good example of this. I was actually working with a pharmacy student when I was still at Auburn University, and had a patient come in with a prescription for warfarin, and the pharmacy was a pharmacy that was run by the school, but it served faculty and staff of the university. This guy was a buildings and grounds worker at the university, big burly guy. He hands over the prescription, and the pharmacy student did a great job, said, is this for you? It was for warfarin. And he said, yes. And he put down a big bottle of aspirin on the counter. And the student looked at him and said, is the aspirin for you? And he looked at her in a very stern voice. And I was standing there, and he said, listen, little girl, I've gotten the lecture. Aspirin's the only thing that helps me with my back pain. So no, I'm not going to stop taking it. And no, I'm not going to the doctor's office to have blood work done just so he can make money off of Blue Cross Blue Shield. She absolutely froze. Now, most of us would label him a difficult patient. I don't see patients as difficult. I see situations as difficult. I see situations as difficult because A, we either don't have the skills to know what to do or say, or that patient now triggers something in us. The listen little girl. If you're somebody
Yeah.
that has any internalized shame at all, that may trigger it in you. That may trigger you thinking, I'm being disapproved of. When the conversation was all done, after I took over, I asked her the question, did you feel threatened by him physically? And she said no. And I said, what caused you? She just shut down. I mean, she shut down and couldn't say anything. I said, so what caused you to shut down? She said, I didn't know what to say. And I said, you're saying you didn't know how to fix it? She said, yes. And I said, did I fix it? And she said, no, you didn't try to fix it. What I actually said to him was, very first words out of my mouth were, you've been getting a lot of relief from your back pain, from your aspirin, and you don't want anybody taking that relief away from you. Also sounds like you've got some questions about your doctor's motives about having you do blood work. He looked at me and he said, damn right. Now, his damn right said to me that I was tuned in, right? There's no way I could have said that if I was in the limbic part of my brain, which is where she was when she froze. You can do one of three
And
things.
the limbic system, the limbic is fight or flight, right?
Fight, flight, freeze.
Okay.
She was in freeze, the 3 F's, right? She was in freeze. The most important point, though, is that she got there because she thought, oh my God, how do I fix this? And MI is not about fixing things. It's about exploring, right? The point, though, is when she's in that part of her brain, she's either going to freeze, she's going to become defensive and say something like, well, you don't need to be taking aspirin without being monitored by your doctor. This drug could cause you to have a bleed. And the patient's not going to want to hear that either. Or you run, you just change the subject, which would not be healthy here either. The point is, you cannot be patient-centered and do MI in the limbic part of your brain. It's impossible. So until and unless you figure out what your triggers are when you're trying to do MI, you can't do MI. Even if you know all the skills, they will not be available. One of the ways that I put this is, if you're being chased by a bear, you do not look back and say, gosh, I bet he's hungry. You have no empathy for the bear. You cannot be bear-centric when you're in the limbic part of your brain. And you cannot do MI in that part of your brain either. And so one of the most important things that I had to learn is, what were those triggers for me that might make me want to fix this patient, become defensive and correct them, rather than explore, tell them, look, you need to take this every day if you want to get your blood pressure down, which doesn't work, So I had to learn what those things were in me, and either do one of two things, either heal them or become aware of them so that they became a trigger not to do the old stuff, but to listen and explore and do MI. So again, it's impossible to do MI and be patient-centered when those things are going on.
I absolutely love that story. And I think it really highlights exactly what we're talking about. Those words, listen, little girl, can be triggering for a lot of women
Yep.
that were told to be quiet, sit down, be still, be seen, not heard.
Yeah.
And there's this, are we taking on too much responsibility of others to make everyone else comfortable around us? There's so many layers that you can get into when you begin kind of this, I call it an open-hearted awareness approach. Just, what am I feeling wounded by? Like what words are being said that instantly make me in my gut go, ooh, oh, I want to get out of this situation as fast as possible. And what I hear you saying when you're talking about being tuned in and connecting with the person in front of you, you cannot do that when your instinct is to run away. So being able to heal, to me, means overcoming those basic instincts in order to stay present, in order to stay in a calm, collected state, that you're not taking on the perceptions of the person you're communicating with, and conversely, you're not putting your own perceptions on them of, well, he just doesn't want to listen to me because I'm a woman, or whatever that trigger can be for you. So I really see how motivational interviewing, so you're saying self-awareness allows us to connect in more deeply with our patients. What would you recommend for someone out there who wants to explore kind of these triggers, these wounds, the shadow, as some people call them? What would you recommend your first step be for healthcare professionals who want to begin working towards healing themselves?
Um, I think it's a great question, and I want to answer it, but I wanted to say one thing really quick. First of all, that was a wonderful synopsis that you just did. I also wanted people to understand that, it was not his words, "Listen, little girl," okay? I think all the things that you said about, being a woman and what that means, and all those things could have triggered inside of her. But I want everybody to understand it was not his words that did it. It was her meaning. And
Right.
and for her, it was, how am I going to fix this that caused the panic? For somebody else, it might have been feeling really small when he said that, feeling shamed, feeling scolded. So again, it varies by person. It may, and there may be some gender issues involved, as you said, too. But you've got to become aware of what it is for you. Otherwise, she might blame him. She might say, it's his fault that I couldn't respond because of the way he talked to me. Now, was the way he talked to her provocative? Absolutely. Sure it was. Okay. But she's still, one of the things I tell people in healthcare is we deal in non-reciprocal relationships. We owe the patient everything. They owe us nothing. Now, we don't have to put up with abuse. Okay. There are lines to be drawn. Verbal abuse, certainly physical abuse. But this was not a case of abuse. This was a case of a patient just drawing a line in the sand, and her not knowing, what am I going to do? In response, I think one of the ways that we start working on these things and healing them is to have mentors. I mentor people, and one of the things that we talk about when we talk about MI, and one of the things that we talk about when I work with, I know you just did a webinar for Aspen RX Health, and I'm their professional health coach. And we talk about these things. We talk about things like, what triggers us and what makes us uncomfortable. So having a mentor is really important. I actually went and talked to a clinical psychologist and said, here are things that I'm having difficulties with when patients say and do this. I want to better understand, why am I having these difficulties? I can always recommend readings to people, like, for example, if anybody is shame-based, Gershon Kaufman, Kaufman, wrote a book called Shame, The Power of Caring. It's the most profoundly important book that I know about shame and how it operates. But the problem is, you can read it and you can understand it, but a lot of times we get up in our head instead of really feeling what's going on. And to me, that's where healing starts. You know, embracing the feeling, even though it's uncomfortable, even though I don't love it. You know, one of the things that I tell people is I give birth to every one of my feelings. They're my little children running around inside of me. And if you're an attentive parent, you don't ignore your children. You take care of them. In other words, you don't push your kids down. You look at them and hold them and say, what's causing this little kid to come up in me right now that I'm feeling small? Why am I feeling small right now? Because if I'm feeling small around a patient, I can't be helpful. And so it's very hard for people a lot of times to accept a lot of the feelings that come up in us, because we've been taught that certain feelings are good and certain feelings are bad, rather than feelings are nothing more or less powerfully feedback about how we are navigating in the world. So when I'm feeling afraid, that's a trigger for me to say, what is it that's causing my fear? What meaning have I ascribed to this situation that's producing fear? If I'm feeling small or ashamed, what meaning have I ascribed to this situation that is producing shame or feeling small or feeling panic? Oh my gosh, I need to fix this or this person is going to bleed to death. You know, so all of it's about learning and feedback and accepting all of those feelings as being ours to take care of. And none of them are bad.
I love that. So, you know, there's this kind of mantra, you got to feel it to heal it. And so leaning into the feelings that are coming up instead of continuing to push them down and recognizing, are those feelings something that I'm taking on the responsibility of others, or am I, putting that responsibility on someone else to deal with it? So that's something I've really been seeing in pharmacy and in healthcare in general, is many of the healthcare providers feel like they're not able to practice autonomously. They're not able to make decisions about the patient's care because of insurance companies, or healthcare reform is definitely taking place in this country as we speak. You know, my whole reason for doing the healing medicine platform, and I want to thank you so much, Bruce, for just being here and being who you are, being able to speak out about this, because healthcare professionals out there are really suffering. They feel disempowered, they're disillusioned by the whole system that we've been put into. So I think beginning to heal ourselves is where I see in the next 20 years healthcare professionals incorporating more motivational interviewing, more open-hearted awareness, more holistic and integrative medicine into our healthcare practices. And the reason that I wanted to do this healing medicine show is to begin having these conversations that have probably really never been had in healthcare before. So, Bruce, I want to thank you so much for joining us here today. It's been a fantastic conversation. Where can people find you if they want to learn more about the Commit Motivational Interviewing Program?
They could write me if they want at B Berger, and it's B and then BERGER consulting at gmail.com. And if they write me out, also I'm on LinkedIn. My profile's on LinkedIn. There's a link to my e-learning program, my 8-hour accredited e-learning program. So that'd be the best way to get a hold of me. I wanted to say one other last thing, if I have just a minute, in asking about, healing, one of the ways that people heal is to also learn that they're not crazy. In other words, meaning they're not the only ones that are going through this. And oftentimes when they start talking to others who are going through this or feel like there's somebody that has their back or an ally, that starts the process of healing also. One of the things I've been really encouraging pharmacists in particular to do is to join their state and national associations. Those associations need our help in order to help have our back. They've got to have the resources to defend us so that if no pharmacist should ever be fired for upholding their standards. No pharmacist should ever have to worry about being fired for upholding standards of care. But state and national associations can't help them when only 15% of pharmacists will join in the first place. So, and that's another place to get in contact with people who are going through the same thing. So anyway, I appreciate you having me and hope this has been helpful.
And thank you so much, Bruce. And I will put the links to all of your contact information and the sites you mentioned below in the show notes. So again, thank you so much for joining us here for the Healing Medicine Show. If you found it helpful, please share with a colleague who would also find this helpful for their own personal and professional development journey.